Lucas, a 10-year-old boy, is brought to his pediatrician for evaluation of bloody urine. A urine sample is positive for hemoglobin and RBC casts. The boy's maternal grandfather suffered from deafness and died of renal failure. The boy also has a 25-year-old maternal cousin who uses a hearing aid and requires dialysis for end-stage liver disease. The boy is indicated by the arrow, his maternal grandfather by the letter A, and his maternal cousin by the letter B. Here we got the family pedigree. What is the most likely diagnosis? The most common causes of gross hematuria in a child are urinary tract infection and trauma. The most likely diagnosis in this case, however, is hereditary nephritis, or Alport syndrome, which consists of glomerular disease, sensory neural deafness, and ocular abnormalities, such as anterior lenticonus, a chronic projection of the lens surface. These patients often progress to end-stage renal disease. This condition is due to a mutation in a gene that encodes for several subunits of type 4 collagen. That is a crucial component of the glomerular basement membrane, GBM, the lens of the eye, and the cochlear basement membrane in the inner ear. What electron microscopic changes are typical of the renal pathology of this patient's condition? In Alport syndrome, the GBM exhibits alternating thickening and thinning. In addition, there is splitting of the lamina densa, the central zone of the GBM, into interlacing strands, giving it a characteristic basket weave appearance. The glomerular basement membrane is both a size-selective and a charge-selective filter. Because of the mutation in the gene that encodes subunits of the type 4 collagen, the glomerulus loses the ability to selective filter. In this case, the altered basement membrane leads primarily to loss of size selectivity. What is the probability that this patient's brother has the same disease? The probability is 50%. The pedigree represents X-linked inheritance. Since the boy's mother is a carrier, each son has a 50% chance, one of the two X chromosomes in the mother, of inheriting the mutation. Though less common, there are also autosomal recessive and autosomal dominant variants of Alport syndrome. How the diagnosis can be confirmed? In addition to urinalysis, an ophthalmological examination and a formal audiogram should be performed, as defects may be subtle. Skin biopsies from which the absence of specific subunits of type 4 collagen can be detected can also be useful in diagnosing Alport syndrome.
This is it. This is our destiny. Again, thank you so much. If you like it, please subscribe. See you next time. Bye.